Prenatal Breastfeeding Class by University of Maryland, Upper Chesapeake Medical Center. The AAP is your pediatrician's professional organization that develops recommendations, policies, and guidelines for pediatricians and other healthcare professionals to follow to help provide the best care for your child. Your pediatrician should be following these recommendations and staying up to date with any changes. The mission of the American Academy of Pediatrics is to attain optimal physical, mental, and social health and well-being for infants, children, adolescents, and young adults. What the American Academy of Pediatrics says is breastfeeding ensures the best possible health as well as development and psychosocial outcomes for the infant. The recommendation is for all infants to be exclusively breastfed for the first 6 months and continue breastfeeding once foods are started until they reach the age of 1 year old and as long thereafter as mutually desired. A recent study done by a Harvard professor found that if 90% of U.S. families breastfeed exclusively for 6 months, the United States would save $13 billion per year and prevent in excess of 911 deaths, nearly all of which would be infants. Breast milk is the ideal food for human infants that provides a unique protection that no other infant food can provide. It has antibodies and living cells that help protect your baby from bacteria and viruses. When the infant receives breast milk, it decreases the incidence of allergies, respiratory illness, ear infections, sudden infant death syndrome, obesity, and arteriosclerosis, helps to prevent dental decay, increase in infant IQ. Breast milk is always changing. It's always perfect for your baby's growth needs. Human milk is unique and it is designed for human babies. The flip side of this is there are risks associated with formula feeding. Formula does increase the risk of baby potentially getting sick. Benefits continued. Breast milk is always ready, convenient, and always just the right temperature. Breast milk is free. Breastfeeding helps to foster bonding between mother and child. Health benefits include quicker return of uterus to pre-pregnant size, less postpartum bleeding, decreased risk of premenopausal breast and ovarian cancer. Mothers also tend to lose weight easier when breastfeeding, and we see a decrease in heart disease. The closer to exclusive breastfeeding one comes during the first 6 months of life, the better the protection and development of the infant. So what is the cost of formula besides your infant's health? Well, in 1 year, most families spend between $2,000 and $3,000, not including extra bottles, antibiotics, and more co-pays at the pediatrician's office for illness. So besides increasing an infant's risk of more sickness, it also puts a child at risk for developing these chronic conditions: gastrointestinal illness, Crohn's disease, inflammatory bowel syndrome, celiac disease, bacteremia, and meningitis, juvenile diabetes. There are disorders associated with formula feeding: malignant lymphomas, multiple sclerosis, chronic respiratory disease, coronary artery disease. There's an increase for the mother for both breast and ovarian cancer, as well as heart disease. Exclusive breastfeeding means your baby gets nothing else but breast milk. It is recommended that the infant receives just breast milk until solid foods are started around 6 months of age. It takes most babies at least the first 3 to 4 weeks to learn how to breastfeed well. Thus, research recommends no bottles or pacifiers until after 4 weeks. Bottles and pacifiers can make it harder for a baby to learn how to breastfeed. At the end of the nipple, there are 4 to 10 openings where the milk flows from. The areola is the darker pigmented area surrounding the nipple. The contrast of the darker skin against the lighter skin acts as a target for the baby to latch onto. The glandular tissue is where the milk is made. The milk ducts carry the milk from the glandular tissue in the breast to the baby. The letdown is a result of hormones triggering milk to be released when the baby suckles correctly at the breast. The nerves around the areola and nipples send a message to the brain to start making milk and at the same to release the milk. When the milk starts to flow, this is called the letdown. Most nursing mothers will feel the sensation as it starts to happen. During your pregnancy, changes in the breast size, sensation of tenderness, and darkening of the areola are all signs that your body is starting to get ready to produce milk. Nipple stimulation can cause contractions, so don't be tempted to try and express any milk during your pregnancy. Colostrum is produced in small amounts. The average amount of colostrum in 24 hours is 1 ounce, with the baby receiving 5 to 10 cc's or about a tablespoon at each feeding. It is perfect for their tiny little stomach. Initially, their stomach is only about the size of a marble. Immediately after birth, your body releases hormones to finish building your milk factory. Every time the baby nurses, your body surges prolactin, the hormone which makes milk. It is very important to nurse your baby on demand in the first few weeks so that you benefit from these hormones and build all of the milk-making cells possible. Slowly, the volume will change. Initially, the milk can be very yellow and small in quantity. By day 3 or 4, the lactose production increases and more water is drawn into the milk, and the volume will increase. If you froze this milk, it would be in layers. The fat or the cream portion would settle to the top. As soon as your baby is born, the nurse will lay your baby on your chest and start drying the baby off. Research has shown that babies do much better adjusting to this new world if they're not separated from their mother at birth. Their heart rate, respiratory rate, temperature, blood pressure, and blood sugar are often normal. Babies even breastfeed better if we just wait for them to lead the way and find the breast on their own. Gone are the days of not letting a mother hold her baby until after the bath and weight check are done. All procedures will be delayed until after the first breastfeeding occurs. Not being close to their mothers at birth causes a lot of stress in a newborn. All babies, regardless of parents' feeding choice, will be placed skin to skin for this reason. Skin to skin has been proven to help infants breastfeed better and decrease breastfeeding issues. Infants have higher weight gains, decreased risk of elevated heart and respiratory rates, and have more stable blood sugars after delivery. They also cry less, with parents reporting higher satisfaction and bonding with their baby. Other issues that can negatively impact breastfeeding is the use of prolonged epidurals and IV medication during labor. Research has shown that infants' motor and sucking skills sometimes can be impacted. They are more sleepy and show more difficulties with feeding in the first few hours of life. During their hospital stay, they sometimes have more feeding issues, spend more time away from their mothers, and have an increase of being supplemented, which can impact long-term breastfeeding. To avoid some of these issues, consider a non-medicated birth option. All of these strategies can help reduce your need for pain medication. Rooming in means you will have your baby with you during your whole hospital stay. This will help you recognize when your infant needs to feed, which is called hunger cues. Signs include sucking on hands, licking, and opening the mouth wide. All exams and tests done on infants will be performed in the mother's room so that parents have the opportunity to ask questions and not be separated from their newborn. Breast milk is produced by a supply and demand. The more you nurse, the more milk you will make. Bottles and pacifiers are not recommended until after your baby has learned how to breastfeed and your milk is completely in. For most women, this takes 3 to 4 weeks. Feed your baby anytime it's showing you signs that it's hungry. Allow your baby to feed for as long as it wants on one breast before switching over to the other breast. Babies need to breastfeed 8 or more times every 24 hours. Focus on the total number of feedings and not so much the spacing in between feedings. It is okay if the baby wants to bunch feedings together. We call this cluster feeding, and they often do this before sleeping for a long stretch. If your baby is getting enough to eat, they will have plenty of wet and dirty diapers. In the first few days of life, it can be difficult to tell if the baby has a wet diaper. Infants typically only urinate the equivalent of 3 tablespoons of urine per diaper in the first few days. On day 1 of life, we only expect to see 1 wet diaper for the first 24 hours. 2 wet diapers on the second day, with an increase of 1 more wet diaper per day until your milk is in. Once your milk is in, you should see about 6 or more wet diapers a day. The majority of women find that their milk is usually in by day 6 at the latest. This is the appearance of a saturated wet diaper. Many of the disposable diapers have a yellow indicator stripe on the outside of the diaper that turns blue once the diaper is wet to alert parents that a diaper needs to be changed. Meconium is the byproduct of the baby's development. It is the first stool an infant will have. When the baby nurses and gets colostrum, it has a strong laxative effect that helps the infant to pass meconium. It is a good sign that nursing is going well if the infant is stooling frequently in the first few days. Infants should have at least 3 stools a day once the milk is in, but it is normal to have more than 3. By the 2nd or 3rd day, the stool will change from meconium to a transitional stool, which can be more of a greenish color. Once your milk is in, the stool will change again to a yellow, seedy consistency. Unlike formula-fed infants' stool that has a bad odor, infants that are fed breast milk have very little odor to their stools. Positioning and latch. Proper position, tummy to tummy or chest to chest. The chin gently is on the breast with the nose slightly off the breast or just barely touching. Ear, shoulder, and hip should be in one line. Position the infant so that your nipple is aligned with your baby's nose, not their mouth. For proper latch, the infant's mouth should be open wide, tongue down before you bring the baby up to you. The lips should be flanged out once they're on the breast. Cheeks should be round and not sucked in, and you shouldn't hear smacking sounds. Watch for early feeding cues when the baby is just starting to wake up. This is the best time to get your baby to latch on. When your baby is just starting to suck on its hands, turn its head with its mouth wide open and stirring. This is your baby talking and saying, "I'm ready to feed." If you wait till your baby is upset and crying, this is a late feeding cue, and it can make it harder to breastfeed. When your baby is born, the nurse will lay the baby on your chest in a laid-back position so that your baby is ready to find the breast and begin feeding once he or she is ready. The football hold and the cross-cradle hold are best used in the first few days when learning to breastfeed. Supporting the back of your baby's head with one hand while holding your breast in the other will help you to teach your baby how to latch on deeply. When you latch your baby at the breast, the mouth should be wide open, as though they are yawning. The lips should be flanged, and the nose should be slightly touching the breast. Allow your infant's hands to be uncovered so that they can touch the breast. This helps to increase the milk supply and improve with latching. It is important to get a deep latch with the infant's mouth covering most of the areola. In the first photo, the infant is just latched on to the end of the nipple with only the bottom lip flanged and the mouth is not open wide. In the second photo, you'll see the infant's top lip is flanged, but now the bottom lip is tucked in comparison to the last photo, which shows a very good latch. Notice in this photo, both the top and bottom lips are flanged. The infant's mouth is open wide, and more of the dark area is now in the infant's mouth. When a baby is done breastfeeding, they will let you know by letting go of the breast completely satisfied. If your baby is still trying to suck on its hands, rooting, or is fussy, put them back on the breast. In the first few days, while you and your baby are learning to breastfeed, it can take anywhere from 5 minutes to feed to 55 minutes for one to finish a feeding. It is normal to have some nipple soreness while learning to breastfeed, but by about 2 weeks, all the soreness should be gone. Pay attention to how your nipple looks coming out of the infant's mouth. It should look round, not creased or beveled like a new tube of lipstick. If your nipple is misshapen, get help with latching with your newborn. For soreness, try a few drops of breast milk or lanolin cream after the feeding to soothe the soreness. Eat what you like to eat, as most foods do not make breastfeeding babies gassy. Try to eat a well-balanced diet and continue to take your prenatal vitamins as directed by your doctor. Caffeine does get into breast milk in very small amounts, so limit your intake to 1 to 2 10-ounce cups a day. Alcohol can also pass into your breast milk, but it is okay to have one drink after breastfeeding and wait 2 hours before nursing again. The rule of thumb is to wait 2 hours between each drink. So if you, for example, go to a party and have a few drinks close together, you will need to pump and discard your milk so you don't get overly full and get rid of the milk since not enough time has passed. Remember, if you are sore or concerned about your baby not getting enough milk, give us a call or stop by one of the support groups that we offer. Congratulations, you certainly have made a wonderful choice to breastfeed your baby, and we are here to help you succeed.